2 years ago, we had a big event where we brought together people from across North West Surrey to come and help us develop our plans for the future of health and care services. And today in Woking, we've had another event where we're reviewing all the things we've achieved over the last 2 years.
We've made a lot of improvements, and some examples are the COSY service, which supports people in the last 4 to 6 weeks of their life to be supported at home.
And we've also, in North West Surrey, developed a service to provide emergency support for people living with dementia and their carers in a crisis, so we can provide care within 2 hours if a crisis arises, such as the normal care situation.
One of the ways that we are supporting people who have mental health problems here in North West Surrey is with the introduction of the self-referral to the psychological therapist service. This allows individuals to contact the psychological therapist service directly, cuts out the need for them to visit their GP to enable that referral to happen.
We've piloted integrated musculoskeletal service, which means that people with joint or muscle problems are seen in one service rather than being bounced around a number of different services, and all of these have improved care on the ground for individual patients.
In 2013 we came up with our partners and developed a strategy, and the strategy identified 6 key areas. Those 6 key areas are what are reflected in the discussion groups behind, so we can revisit and refresh those and work forward from there.
We're very aware that there seems to be a big difference between the work and the resource that's currently being provided in the sort of the out of hospital area, which includes primary care as well as community services and social care and the voluntary services. And the emphasis, I suppose, traditionally has been much more about provision of care in the acute sector. So we're encouraging people to think of maybe a different model for the future, where there's an equity between the out of hospital piece and the work that has to be done in hospital, but it's more balanced.
It's fabulous that today we've got Ashford St Peter's in the room, we've got Virgin Care, we've got adult social care, we've got CCAM, the ambulance service, we've got our mental health trust, we've got the boroughs and districts. Everyone today is here to find out what can we do to better serve the people of North West Surrey, and that includes the voluntary sector and of course the public themselves.
So the 6 groups, as you can see behind me, are all about the individuals and stakeholders having the opportunity to look at the new model of care that's building on the past and have a key influence and ability to change things and push things forward.
Yeah, it was really good because actually our stand we were full on the 3 separate occasions that people came round, and there was lots of interest in it. And I just got the feeling that everybody was really keen on the ideas we had, and particularly because we had people from the secondary care sector, from the voluntary sector, we had community services there, and everybody was keen to hear what the model was like going forward, because in a way it touches everybody, so it's important what's happening in general practice.
Well, I've come along today because my job is all about ensuring that people with long-term health conditions, whether physical or mental, are involved and can influence the future design of services. So I've been really pleased to have come and to found that the CCG really want to hear from the patient's perspective. And it's not just been myself, but there are lots of people here representing patients' groups from GP practices and other places. And I hope that they, plus all the voluntary sector organisations who really underpin the care for people in their communities, can work with the CCG to make sure health, social care and all the other services are joined up for people. And I think the other thing to add that's been really good to hear is about how future services will wrap around the patient and their carers and families, and that the focus will be on ensuring that whatever illness or condition you have, that somebody's going to be responsible for making sure that you get the care right from the beginning at diagnosis right through to the end.
My hope is that lots of people will get involved in what the CCG is doing, that we've got lots of decisions to make in the next few years about how we prioritise the use of resources, and I hope that after today all those people who were here will spread the message, but they'll also want to get involved, and we'd encourage them to come forward.